I think our medical system right now it feels like damage control. We're like, oh, you've got leakage and prolapse. Let's do a surgery and fix it. And then, we kind of send you on your way. But I'm like, well, could we have done anything to prevent that? Can we see this patient? Can they do work before surgery and after surgery to maximize the benefit of that surgery and make sure that it's long lasting? Can we give them tips and tools to make their muscles strong and healthy following that? I think we're just not giving women this education.
This is episode number 665 with Sara Reardon. We are going to be talking today about overcoming pelvic floor issues. Pelvic floor issues are a real thing, and they don't have to be so complicated. Sara Reardon is a pelvic floor therapist. She has a huge following on Instagram, and she is nicknamed the Vagina Whisperer. So this is an important conversation for anybody who wants to know more about how to have the healthiest body, especially when it comes to your pelvic floor and your sex life. I am Sandy Weiner, certified dating and relationship coach, and every week I bring you expert advice and real conversations about love, connection, and healthy relationships. At Last First Date Radio, we believe it is never too late to go on your last first date. For more information on my coaching programs, courses, and books, go to lastfirstdate.com. And before I bring Sara on, I want to just give a shout out to my Facebook group. It is called Your Last First Date. It's for women over 40 who are ready to take a positive approach to dating and relationships and not just go somewhere to complain, because that's really not helpful. Sure, it doesn't always go great when you're dating or in a relationship, but when you have the right kind of support, and that's what we provide there, you will have a much, much healthier experience. So join us at Your Last First Date on Facebook if you are not yet a member. Dr. Sara Reardon has written a new book called Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage. She has built a robust community online as the Vagina Whisperer with 664,000 Instagram followers, 13 million TikTok views. That is quite a lot. And she teaches women how to prevent as well as overcome pelvic floor issues at every stage of life, with simple tips like squeeze before you sneeze, to more advanced protocols to prepare for childbirth or navigate changes during menopause. Welcome to the show, Sara.
Thanks so much for having me.
I'm so excited about this topic. I never even heard of pelvic floor therapists until I had to go to one. Actually, I didn't have to, but I had a fantastic gynecologist who suggested it because I was having painful sex. And I think that it's such an important thing for people to know about. And it's not just for things like painful sex. There's so many things. So give us a little idea about what a pelvic floor therapist does before we even dive into the whole thing.
Perfect. I think women don't even realize they have what's called a pelvic floor. So, and all genders have a pelvic floor. My book, Floored, focuses mainly on women because we are more susceptible to pelvic floor issues. The pelvic floor is a group of muscles that sits at the bottom of your pelvic cavity. So we're used to those ring of bones we see on the skeleton model. And at the very bottom of that is a basket or a hammock of muscles called your pelvic floor. And it supports your organs like your uterus or ovaries, your bladder, which holds urine, your balls, which hold stool. It has openings to let urine exit, let your bowel movements exit, and then also for the vagina for vaginal intercourse and menstruation and vaginal birth. And as a physical therapist, I specialize in treating muscles and tissues and nerves, but as a pelvic floor physical therapist, I specialize in treating the muscles and tissues and nerves in the pelvic region of the body, including the pelvic floor. So if you have issues like urinary leakage, pelvic organ prolapse, painful sex, even hip pain or tailbone pain, frequent urination or discomfort with bowel movements, your pelvic floor muscles are usually involved. And that's where someone would see a specialist like myself.
I hope everybody took that in because you said it also, men have a pelvic floor. So tell us
Yes.
how that affects men.
So all genders have a pelvic floor. The difference between the male body and the female body is males don't have a uterus. Obviously, they have a prostate. And the male pelvic floor has two openings where urine exits and for bowel movements, where the female pelvic floor has three openings. But the difference is we go through experiences as a woman like monthly periods or childbirth and pregnancy and then menopause, which kind of directly influence our pelvic floor and put us at risk for, say, pelvic floor issues. What we see in men is they can also develop pelvic floor issues, but they're either related to their prostate or they're like a muscle tension issue, which can cause difficulty starting a urine stream or frequent urination, straining with bowel movements, pelvic pain, rectal pain, or sexual dysfunction like erectile dysfunction, premature ejaculation, or discomfort with orgasms.
Well, thank you for sharing that. I think that people just don't talk about these things in general, and there's so much shame and also lack of knowledge that is so important for all of us to deal with. And I know that when I saw a pelvic floor specialist, she was just so compassionate and kind and gentle and a lot of permissions, is it okay if I do this? Is it okay if I do that? But also a lot of talking and really finding out more about me. And so I know that you have a huge following on Instagram and TikTok, and you're known as the Vagina Whisperer. So tell us a little bit about how you came to that nickname.
So I've been practicing as a pelvic floor therapist for almost 18 years. And so I've been in this field for quite a long time. It's the only type of physical therapy I practice. And as over the past, I would say 5 or 6 years, I've really seen quite an explosion of pelvic floor awareness and more activity on social media that have let people know that this type of therapy exists. About, I would say in 2016 or 2017, I started my Instagram account called the Vagina Whisperer because that's what my friends used to call me. And it was really sharing tips about pregnancy and birth and postpartum recovery and what I was doing during my pregnancies and birth, and then also what I would educate my patients on. And I shared it with my group of girlfriends, and it has just organically grown. I mean, the account has hundreds of thousands of followers. And, I think a lot of that is because women weren't getting this information and they're still not getting it. And they deserve it. They want it. And they're going, well, why isn't anyone else telling me this? That I can, have exercises to help with leakage or that there's therapy for painful sex or that the way I'm, peeing or pooping could affect my pelvic floor. So it's really been awesome to share this information with women and help them better understand their bodies and also, give them tips and tools and now a book, my book Floored, that can give them relief, to give them options for relief instead of suffering silently or feeling really embarrassed or ashamed of what they're experiencing.
Yeah, that's so important. I love that you're doing that. And you mentioned your new book, which came out June 10th. So tell us a little bit about why you wrote that book and what it's about.
So it's really interesting as I never planned to kind of be an author. I think of a lot of what I've created on social media and I created an at-home pelvic floor fitness platform was people said, "Hey, do you have this?" Or "I think you should do this," or "This would be a great thing that, women would really want." As you mentioned, as PTs, we listen. We're kind of listening as to what people are telling us or asking us and really trying to find ways to give them the resources to help themselves. Someone messaged me, just sent me a cold email from, social media and said, "Hey, I'm an editor at HarperCollins and I'm a follower on your Vagina Whisperer Instagram account. And I really would want to talk about you writing a book because there aren't a lot of them or any of them out there. And women really need to know this information." And so it just started with a conversation. And then about a year later, once, I got an agent and I had a PT clinic that I had to take a step back from and not be managing and running the business to make space for the book. And then I really dove into the research and like what was new and evidence-based and pulled in patient stories so that women could feel less alone when they're talking about these issues and just really made a guide for women for every stage of life. I could have written a book just about menopause and the pelvic floor or just about birth. But I think we don't even have the basics, as you mentioned. And this is really a great starting place for women of any age or stage or with any type of pelvic floor symptoms, whether it's leakage or prolapse or pain, to really start understanding their bodies and get tips and tools that they can start at home to get relief.
Well, it's wonderful that you got that cold call email and that
I
you
know it was
pursued
quite
it.
lucky.
Yeah, it's amazing. I mean, I think most of us don't start out wanting to write books. Like I've written
Right.
3 of them already. And the first book I wrote, I was just like, this book just came out of me. It had to come out of me. And then people were saying, well, we need a guide on how to date better. And so that book came out. And the last book I wrote was true stories about people who found love later in life. And I felt like people needed hope because they were losing hope. So it's these books come right now. There's no book brewing, but I love that you wrote this, and it's going to help so many people.
Right. And to your point, I mean, people say, like, hey, we want this, we need this. Would you be open to this? And you're at a space in your life where you're like, yeah, I feel that, or I have space for that, or I want to do that. I also think how we reach people varies now. Maybe I think there was a time prior to social media where it was like blogging, and then now it's social media and it's videos. But the way that people consume content or information, they want to have options. And I think that not everybody wants to scroll on my Instagram reel to find out like what you need to be doing during perimenopause to care for your pelvic floor, or, good lubes to try, or, proactive tips for peeing and things like that. So a lot of it is just a place where you can find everything in one spot. And also, I think these are private issues. Not everybody wants to talk to somebody about them to start. So, how can we kind of start educating people and giving them language for their bodies, or giving women language for their bodies, and also feeling comfortable approaching a doctor or a physical therapist so they have a better sense of what to expect?
Yeah, so let's talk about approaching your doctor because I've been a huge advocate for being informed when you go to the doctor and not taking a doctor's word as gospel. I've actually been kicked out of a practice because I refused to have my doctor do a colposcopy on me because he said it's not painful at all. And I said, my friends have told me that it's really painful and it's like worse than childbirth. I mean, that was what I was told by several people. And he denied it. And he said, it feels like you're brushing your skin with a hairbrush. And I'm like, you're a man and you're denying my concern. And he was the head of the practice, and they kicked me out of the practice because I refused to have it done by him.
Yeah.
So I found somebody who would do it with anesthesia and totally supported me. And so women, go to their doctor. They're told they're dismissed basically that their pelvic plane, their leakage is normal. It's part of aging, part of whatever. What should they do if that's what their doctor says?
Find a new doctor. It's easier said than done. And I've been in that position just like you. When I was pregnant, I wanted to have a doula in my delivery room. And I was 21 weeks pregnant with my first child. And having been in this field for a long time, I was like, okay, I know what the research says about what's going to minimize my chances of this type of birth or this type of trauma. And I went to my doctor and said, hey, I want to have a doula during my birth. Like, how do you feel about that? And she said, I feel like they just get in the way. And I said, okay, thank you for sharing with me like your thoughts. And then I went and found a new doctor, which was hard. Not everybody wants to take a mid second trimester pregnant mom on their hands. But what I tell women is that you do have to be your own advocate. You get one body, you get one pelvic floor, you get one uterus and cervix, and you do have to be the driver in your care. And if you have a medical provider who you either feel like is gaslighting you or not listening to you or dismissing your concerns, you're right, they are. And you do need to do the work to find somebody new. And it's unfortunate that we still have to kind of go down rabbit holes on Google and Reddit and social media to find these resources. But we do because, it's very clear women are gaslit more in medical care than men, and that pelvic floor issues are continuing to go undertreated, and their medical providers are not listening to women about their pain. So you do have to do that. And I just tell women, like, you're going to have to push, but don't let it be the end of your story. Like, don't let that experience resign you to living a life of pain or discomfort or leakage, because you deserve better. And don't let that one person shutting you down let you think otherwise than that. But it's hard. And you and I have been in those situations, and it's really hard to have that courage. But I wrote Floor so that people know that they're not alone and that they know there is help available if they're experiencing pelvic floor issues.
I think it's such an important thing to empower women to make better choices for themselves and to know that doctors are not gods as they were once thought to be. And it doesn't matter if it's a female or a male doctor, you could be treated poorly by anybody. And you have to know what's important to you, what your philosophy is around your medical care. I know this started for me a very long time ago when I had a child who was 4 months old who was having a lot of ear infections, and we were told he needs tubes. And I said, he's 4 months old, and we're not putting tubes in his ears until we find out why he gets ear infections, not just treat them as they come up, which wasn't helping. And I went down a whole area of study of alternative medicine and how to eat differently and how to, I mean, I cured him basically of his ear infections. And I found a physician who would support me.
Yeah.
And she was incredible. I mean, she would come and make home visits to make sure that his ears were okay. She started stocking some herbs in her office. She totally bought into it. But it's you have to know yourself and be strong enough. And not everybody has the courage to do it. But I want to encourage everybody to take charge of your health, especially your pelvic floor, especially this thing that we don't know a lot about. So, do you have any tips right now that you can share for people who want to begin to take care of their pelvic floor?
Yeah. So, and, in the way that the book is organized is I kind of go through systems of the body. So bladder health, bowel health, sexual health. And then I also go through life stages like menstruation, pregnancy, postpartum, and menopause. And it's because your pelvic floor requires different things at different life stages. So if you are perimenopausal and menopausal, the things that you're doing, proactively strengthening your pelvic floor, using a vulvar moisturizer or lubricant, talking to your medical provider about topical estrogen for the vulva and vagina, things like that, that you really need to kind of proactively do to help prevent issues or help prevent issues from getting worse. I want people to have those tools. I think our medical system right now it feels like damage control. We're like, oh, you've got leakage and prolapse. Let's do a surgery and fix it. And then, we kind of send you on your way. But I'm like, well, could we have done anything to prevent that? Can we see this patient? Can they do work before surgery and after surgery to maximize the benefit of that surgery and make sure that it's long lasting? Can we give them tips and tools to make their muscles strong and healthy following that? I think we're just not giving women this education. And so some of the things are, I list them in the book, and it's like knowing the proper way to pee. Don't push when you pee. Just sit down and breathe and let your stream flow. Don't go just in case to pee. If you have the urge to go, go, but so don't delay it too long, but don't go every time you cross a bathroom or leave the house or arrive somewhere because it can cause your bladder to shrink. For bowel movements, use a little stool under your feet to help your muscles relax, your pelvic floor relax so that you don't strain, because straining can weaken your pelvic floor over time. Using a vulvar moisturizer for vaginal dryness, which can happen during perimenopause and menopause, or when you're postpartum breastfeeding or you have low estrogen stores. I think things just to kind of help optimize our comfort, prevent pelvic floor issues that, again, we're just, even how we sit, how we stand, how we breathe, just these basic things that I feel so lucky to know because I'm in this field. And I'm like, really, every woman should have this knowledge.
So true. Yeah, I think those were surprising things to me about how to pee correctly. Like nobody teaches us how to pee.
Right.
And I was just recently in Israel staying at my daughter's, and I didn't have a bathroom in the little kind of shack in the back of her house that I was staying in. And she was like, always just try to go to the bathroom before you go, just go so you don't have to get up in the middle of the night. And in that case, maybe it was a good idea, but because I didn't want to get up at 3 o'clock in the morning, have to go into her house. But it's that constant pushing. So you're saying that it can actually shrink the bladder
So,
when you push
mhm.
like that?
No, so pushing weakens your pelvic floor. So think about like if
Mm.
you're, you're sitting down, your pelvic floor is over an open hole, you've got contents above it, and you're pushing, that can weaken your pelvic floor just by stretching it out. Think of like a trampoline that you're like jumping on, right? It's gonna like kind of make it go sink down a little bit. Going to the bathroom or peeing just in case can shrink your bladder because the way that your bladder fills is it's a muscle. It's like a deflated balloon. As it fills with urine, it stretches, and that stretch sends a signal to the brain that, hey, I'm going to have to go pee soon. I'm going to get full. And then you can kind of delay that urge for a little bit and then make it to the bathroom. And then when you have to pee, your muscles relax, your pelvic floor and sphincter relax, and your bladder, which is a muscle, pushes the urine out for you. So if you're going to the bathroom all the time, you're not letting your bladder stretch to even give your brain that signal of I have to go, and then it shrinks. So then it only takes a little bit of urine for you to be like, oh, I gotta go, and then it empties, and oh, I gotta go, and then it empties. And then if you don't have that muscle strength or coordination to delay the urgency, you can end up leaking or feeling like you can't delay the urge, and then that can lead to kind of weakness over time. So again, it's these kind of small habits that we just aren't aware of, and I see a lot of them pop up during pregnancy and postpartum and then kind of persist on into perimenopause and then menopause. And it's not until, say, like someone like yourself, you're experiencing painful sex or something, and then you go see a physical therapist and they may teach you all of these things and you're going, well, why didn't I learn this sooner? I think that that's the one thing I want to kind of really have women walk away with is like, you know better now. You can educate your daughters, your granddaughters, your friends that some of the daily habits we have can really help improve your pelvic floor health.
Let's take a quick break to hear from our sponsors. This episode is brought to you by Amazon Music Unlimited. You can listen to over 70 million songs and thousands of playlists and stations. Plus, you can now stream your favorite podcasts like Last First Date Radio. You can listen to any song, anytime, anywhere, on any of your devices. Get Amazon Music Unlimited for free for 30 days. Just head on over to getamazonmusic.com/lastfirstdate to learn more and claim this offer. Let's talk about something else that I've been seeing a lot lately, which is things like vaginal deodorant. That's become a huge industry. It's like, oh, for your whole body. I'm like, what are we talking about here?
Yeah.
What are your thoughts about this?
So it's interesting because I think as more awareness of pelvic floor health and vaginal health has become what's popular on social media or kind of in an effort to elevate women's health, it becomes a little bit more of a topic for businesses as well. There's a chapter in the book called "The Business of Our Business," and it talks about how there's a lot of businesses that are coming out with products that may not be really helpful and sometimes even harmful to our pelvic floors. Any like a deodorant for your whole body. I think that there are certain parts of our body that are supposed to have a scent, our underarms, but we may want to deodorize them. You don't want to put anything in your vagina or on your vulva, which is the external part. The vagina is the internal canal. The vulva is the external part that could disrupt the pH balance of those tissues because the pH balance is very specific to help ward off infection. And when you change that and introduce a new chemical or product, that pH balance will get disrupted, change the microbiome, and put you at a higher risk for infections. So if there's an odor, I always say, like, one, make sure that there's no infection present. See a medical provider, get cleared of bacterial infection, urinary tract infection, a yeast infection. Two, like, there should always be a little bit of a slight odor to the vulva and vagina. It will change throughout the month depending on your cycle. When you have less estrogen and more estrogen. So that's normal. I mean, we shouldn't think of this part of our body as something dirty, or like that needs to be cleansed really or deodorized because there should be a normal scent to it. And three, that some of these products can be harmful. Like some women want to put it like under their tummy folds or around their groin, which is one thing. But I think putting it on the vulva and vagina itself I would avoid that because it can really put you at risk for other things that can compromise your health.
Yeah, I've always stayed away from any of those products, like the douching and all those things that were popular when I was growing up. It's like just scent yourself. I hate scenting your house. Like I really I don't know. We're always trying to cover up other smells that are natural. And Yeah, and then there's a lot of stigma about, do I smell right? And is my smell turning people off? So, speaking about turning people off, if we have a partner and we want them to support us if there's pelvic floor pain like I had had, how can women ask for support or get their partner to support them?
I think one of the biggest things is it's knowledge is powerful. And often women don't understand because we haven't been educated about this part of our body that these are muscles and tissues and nerves like any other part of our body. And when pain is present, that's information. That's information from our body that something's not quite functioning the way it needs to be. So I really view the pelvic floor like any other part of the body. It's like working with an ankle or a shoulder or back. If you have back pain, you would probably tell your partner, "Oh, my back hurts when I do this," right? Or like my shoulder hurts when I try to put my bra on. This part of your body is no different. So I think the first thing is you having an understanding of is the pain from a pelvic floor muscle issue or a hormonal issue or a dryness issue and addressing that. I think that the second thing is often bringing partners in. If you've got a really great supportive partner, they want to help you. They're solution oriented. So it could be like, hey, getting a massage on my hips really helps release my pelvic floor, or doing yoga with me, or, getting a better mattress so that, I don't have as much hip pain. Using a lubricant doesn't mean I'm not aroused. It's that I have vaginal dryness from hormonal changes. So I think the communication is key. Sorry, I think communication is key. And I think helping your partner help you puts it less on you. I think so often when we have sexual pain, we feel broken. We feel like we just need to endure it. We feel like it's our problem when it's not a you problem, it's a we problem. And I think that if, just like when you approached your doctor, I think that there's something behind that when someone doesn't want to be supportive, but most often I think partners do want to be supportive. And I have partners reach out to me all the time on social media and say like, "Hey, I think my wife has this," or like, "Hey, can you help her because she's been struggling with this and I'm researching what to do." So I think that there's a way to involve them, whether it's using vaginal dilators or massage or internal massage, and things that can be therapeutic and really make it feel like a team effort versus that there's just more on your to-do list to help take care of yourself.
I love that you brought in communication because I think communication in general is essential for a healthy relationship, and also that it's not just about you, it's about the two of you. And you want support. And so knowing what kind of support you need and how they can support you, doing that research first is really helpful. So if a woman wants to find a pelvic floor therapist and she can't find one near her, what should she do?
So the good news about medicine now is that you have a lot of options. So the first thing to find a pelvic floor therapist, there are a couple of websites that you can search. One is called pelvicrehab.com. One is the Academy of Pelvic Health, which has a PT locator to find pelvic floor PTs in your area. Another one is called Global. I think it's Global Pelvic Health has, if you're listening to this outside of the United States. But you can also go to Google. There are pelvic floor therapists in every major city now. However, if you don't have access to one or there are limitations to access, whether it be schedule or finances or resources, you can do telehealth now. Every state, there are telehealth therapists where education is a huge piece of this. There's research to show that 1 hour of education on your pelvic floor can actually help improve your symptoms because you're learning about this part of your body and how to use it properly. Obviously, there are online exercise programs. I have one called the V-Hive, which gives you pelvic floor exercises you can do at home, whether it's for strengthening, it's for painful sex, it's for pregnancy, it's for perimenopause, so that you have something from a certified specialist to give you resources at home that you can start with. And then there's other things like, I have my book coming out and there's blogs and things like that where just really education's a huge piece of it. And I do tell people there's a lot of products out there or procedures or devices that promise a quick fix. And unfortunately, there is no quick fix to a pelvic health issue. Typically, we've been dealing with it for a long time before we start seeking help or even realize our pelvic floor is involved. So I really encourage like consistency and patience, but improvement and progress is very easy to make. And another question I get is like, do I have to do these exercises forever? And I'm like, well, do you have to brush and floss your teeth forever? No, but if you don't, you're probably not going to have like the best dental hygiene. So some of this is just things that you can integrate into your day-to-day life that feel really easy and manageable, but will help your pelvic floor in the long run.
Lots of resources and online, offline, any buy your book, take your programs. But thank you for sharing some of those websites. And my final question for you is the question I ask everybody, and I'm not sure how you're going to answer it, but what are your final words of advice for anyone who wants to go on their last first date?
I'm come from this as a woman, as a mom, as a married person, as a pelvic health therapist. I think the most important work that we can do is on ourselves. It's not on the relationship that we're looking for. And I think when I have worked on myself, whether it be physical or spiritually or mentally, I think that that is where I've found the most growth, where I've identified like what do I want, what works for me. And I think the last thing is when my husband and I were getting married over 12 years ago, a friend was talking to us about like, oh, what do you like about this person? And what do you like about, them or, and it's really like, he's like, what you could really think about, like, how do I like myself with them? Like, am I a better version of me with my partner, with this new partner? When you go on a date with someone or you are with someone, do you like who you are better? Are you more comfortable, more relaxed, more confident, more expressive, more open, more adventurous? But I think we really want to look for the best version of ourselves and who brings that out versus like, what do they bring to the table?
Good question to ask yourself because yeah, it's usually people don't really even know what they like about the other person. They'll list things that are not really that important in the long run, but who you become when you're together is so essential. It's people bring out different things in each other, and every relationship brings out different parts of us. And one of the questions I ask in my dating debrief is, what side of you came out on the date? And it's like, did they bring out your happy side, your funny side, your intellectual side? And do you like who you are when you're together? And it should be for both of you, that both of you should feel that way. And I love that.
Yeah,
Better
and
together.
it is. And I think even, when you were asking the question earlier about like if you have a partner and when I think that I'm like, gosh, I want that for everybody who they have a partner who they can talk to about those pelvic floor issues, who they can feel like something feels off or you can express to them how you're feeling or how you're doing because this is healthcare. This is not like vagina care. This is healthcare. Pelvic floor health is healthcare. And so if you were experiencing any health related issue, your partner, you would go to your partner. And I just want to encourage them that this is no different.
Yeah, I mean, part of the reason that I'm no longer seeing the person who I had gone to the pelvic floor therapist about was because he didn't communicate with me, because he just shut down. And that's not going to work for me. And I felt it in my body. I felt that my whole nervous system was a mess. And I did not become a better part of me when I was with him. So thank you so much, Sara. I think this is such an important conversation. I wish you the best of luck with your new book. And do you have any final thoughts before we go today?
No, I really want to thank you for being open and vulnerable and sharing this with your community. I think that, again, we do often feel alone when we're experiencing pelvic floor issues, but they really are so common, but they're also really treatable. So I just encourage anyone who's listening who might think that they have an issue to know that it's never too late and that help and resources are definitely available.
Yes, thank you so much. And thanks everybody for listening. If you love our show, please rate us, review us on Apple Podcast or Spotify. Leave me a comment on Spotify. I read all the comments. And as always, here's to your last first date. If you are ready to get unstuck, gain new tools, become more empowered, and finally find your last first date, I'd love to talk to you. Fill out an application to be considered for a complimentary half-hour love breakthrough session at lastfirstdate.com/application.